So I'm going to talk about a laparoscopic hiatal hernia repair. The reason that I chose this as my presentation topic is because I have actually seen one of these in person. About a year ago, I got to sit in on a surgery whenever I shadowed a physician assistant. So it's a little bit more familiar to me, so I'm just going to tell you guys about it. So some symptoms that you may experience that could send you to the doctor that could eventually lead to this surgery happening. So some regurgitation, so that is just whenever you eat and then the food comes back up into your mouth. Dysphagia, so that is whenever you're having trouble swallowing, it's not feeling like it's working correctly. Early satiety, that is whenever you only eat a small amount, but then you just feel full super fast. Chest pain or discomfort, shortness of breath, that's you're just having trouble breathing, or heartburn. Heartburn is pretty common. It is when your stomach acid makes its way back up into the esophagus. It can cause a lot of discomfort and a burning sensation. So a lot of these symptoms are also associated with gastroesophageal reflux disease, also known as GERD. So sometimes the hiatal hernia and GERD, people use them synonymously, and while they're not the same thing, they do go very hand in hand. They have a lot of the same concepts and symptoms, and they definitely do work together. So diagnostic tests, how we're going to figure out if this is happening or if surgery is needed. So you can do x-rays. You can do an endoscopy, just put a tube down your throat and we'll see what's going on down there, seeing if there actually is a hernia, or a manometry that is kind of associated with this symptom of dysphagia. So you're having your trouble swallowing, the manometry can test the muscle strength of your esophagus when you're swallowing. So it can see if there's any sort of problems. So causes, there's not really one thing that we know causes this hiatal hernia. It could be present at birth. You could never even know you have it. A lot of people are asymptomatic and live their everyday life with it with no problems. But then also other people have it and it needs to be repaired. So something that could cause it is a weakness of the diaphragm. So your esophagus travels through the diaphragm to reach your stomach, and it goes through this esophageal hiatus in the diaphragm. So whenever the muscle of the diaphragm is weak, then your stomach can make its way back through, and that's when the problems happen. So repeated acid exposure, if there's a sort of problem with that sphincter in your throat or in your esophagus into your stomach, then it can cause the acid to travel back through. Repeated acid exposure can cause this hernia to appear. So obesity, chronic lifting, trauma, this all causes a lot of strain on your abdomen. So any sort of differential, it can just move stuff around in your abdomen, put it where it's not supposed to be. What's it look like? There are 3 types of hiatal hernias. Type 1 is the most common, and that's the surgery we're going to talk about, is fixing that kind. It's also called a sliding hernia because the stomach is sliding its way back through that diaphragm. So the other 2 types are more dangerous because it's kind of creating this pocket in the stomach that's made its way through the diaphragm, and it can kind of pinch it off. And whenever that pinch happens, it can cause it to not get enough blood flow, and that's a problem that could really result in emergency surgery because it is so dangerous. So surgery, this used to be an open surgery. They would cut you open and get it all fixed in an open surgery. But now there is a way less invasive way using a laparoscope. So first they're going to create an incision right above your belly button and put a tube in and fill your stomach up with carbon dioxide. So when your stomach fills up, it's creating some room in there for the doctor to work around whenever they do the surgery. So then you put the laparoscope into the incision, and the laparoscope has a camera and a light on it, so you're able to see what's going on in there, and it kind of feeds it to this computer in the operating room so the doctor can see what's going on inside your stomach. And then there's more incisions made around the abdomen that the tools go through, and the tools can be used to move things around, manipulate things, sew things up, all kinds of stuff. So it's definitely very useful. I am now going to be doing a basic explanation of the hiatal hernia surgery. So like I said before, this is a laparoscopic surgery, so it doesn't involve cutting you open. There are just several small incisions around your abdomen that the surgeon can insert tools into so they can work and get the hernia fixed. And then there's the laparoscope inserted with the camera and the light that feeds a video to a screen in the operating room so they can see what they're doing. As you can see, the stomach has worked its way through the esophageal hiatus of the diaphragm and created this hernia. So as the name shows you, it says esophageal. This means that the esophagus is the only thing that is supposed to feed through that hiatus. And as you can see, it is kind of being pushed up by this hernia. This lower esophageal sphincter is supposed to line up with the esophageal hiatus. So that's what we want to fix. Step 1 would be to pull the stomach back through so it returns to its normal position with this lower esophageal sphincter situated right here in the hiatus. So here it is pulled through, it is back in its normal position, but there is a problem. Since the stomach went through here and stretched out this muscle so much, there is still a gap, basically, so the stomach could potentially work its way back through. That is something that needs to be fixed. So step 1 would be to have these sutures put along the diaphragm to tighten that muscle and create a smaller hiatus, again, just so the esophagus can feed through and not the stomach. There's another precaution taken in this surgery to ensure the stomach doesn't work its way back through that hiatus, and that is whenever we use the fundus. So as you can see in this picture, the hiatus has now returned back to its normal size with the sutures in place to keep it that small size so that it's only the esophagus feeding through it. That next part involving the fundus that I previously talked about is called a fundoplication. This is just another precaution to ensure that the stomach doesn't work its way back through. The surgeon will take the top of the stomach here, the fundus, and wrap it around the esophagus. This wrapping around creates a sort of belt at the top of the stomach and at the base of the diaphragm. As you can see in this picture, the esophagus is underneath it and then the fundus is wrapped around. So this just, while it ensures that the stomach won't make its way back through, another benefit of this is it decreases the chances and almost completely takes away the chances of acid reflux. That is because this sort of pocket counteracts any sort of pressure differential or just gas buildup in the stomach that would normally cause that acid reflux and that discomfort in your esophagus. So not only is there the benefit of keeping the stomach in its place, but it also gets rid of that symptom that a lot of people are experiencing. Recovery for this surgery is relatively short because it is not an open surgery. There are just those 5 incisions that you must take care of. You should be given advice and information about basic wound care before you are discharged home. Infection is less likely to occur with this surgery, but it is still important to take care of your incisions. You will be on a liquid diet for about a week, and then you can switch to your softer foods, and then after that, you can return to your normal diet. Experts advise that you should not be drinking alcohol, driving a vehicle, or showering for the next 24 hours. Alcohol and driving a vehicle are not recommended because you will be under anesthesia for the surgery, so afterwards you will be drowsy. Lots of rest is advised to help with this drowsiness. It is recommended to avoid strenuous activity for the next week, You can begin some normal activity about 24 hours after the surgery if your body permits, but is not recommended to lift over 10 pounds. Like I said in the beginning, this recovery is relatively short compared to any other surgery that would require you to be cut open. So there are many benefits to the laparoscopic route of surgery, and recovery is a huge one. Because of this faster pace of recovery, it also decreases the chance for infection or secondary illnesses due to the surgery. That makes it a lot safer and low risk. I hope you guys learned a lot and found this surgery just as interesting as I did. Thank you.